Okay, so this is everything wrong with the healthcare system. As you can see, we have all these different entities that appear to be separate, but as we'll see, they work together in a very complex system that ultimately results in benefiting all of the elites, all of the established people, and just ends up screwing you by making you less healthy and ultimately making you pay more. So if we start with big food, they're really at the epicenter of everything because they create all this toxic crap food that ultimately leads to all the disease that all these other entities have to deal with. So big food will lobby to the government using their trade groups, and essentially what they will do is they will lobby for policy for the dietary guidelines, which obviously they don't know a damn thing about what the dietary guidelines should be because we're in a chronic disease epidemic. And they will also lobby against laws that attempt to cut down on our refined food intake. And then the government obviously controls these two bodies, those being the FDA, as well as various public health organizations. So these are organizations like the CDC, the NIH, the HHS, and the USDA, and they also will dictate policy. And then, specifically the NIH is intimately tied with academia because they will sponsor their work and all of the available literature and the research is published through the NIH. So they're obviously having some control over academia. So big food also pours money into lobbying for these non-government health organizations. So these are your American Heart Association, your American Diabetes Association, Academy of Nutrition and Dietetics. I mean, you can watch our entire video on the Academy. They're literally pouring in millions and millions of dollars in order for these organizations to put out garbage policy. The American Heart Association was literally launched by Procter & Gamble, which was the first makers of vegetable oil. So that just goes to show how intimately tied big food is with all of these health organizations. So big food is also tied to academia. Why? Because they're the ones funding a lot of these studies. I mean, if you need a study done on the effects of soda on long-term health, who do you think is going to be funding that study? It's Coca-Cola. You can also check out our video on the sugar industry lobbying that happened in the 60s in Harvard, essentially paid off scientists to blame saturated fat instead of sugar, which we now know is a huge risk factor for heart disease. So then these non-government health organizations will actually get to doctors, one, because they're so ubiquitous and everyone just blindly follows to whatever they say because they're sheep, and also because they will actually pay these doctors. They will offer to essentially wine and dine them and allow them to continue their medical education, but it's really just to bolster whatever their agenda is, which is obviously from big food. And then of course, where do doctors get their education? From academia, right? They go to med school. So then also with academia, so they're getting funding from big food, their outcomes are largely biased, and then who do they feed? Where do you think that all of these public health organizations get their research from? They get it from academia. So do these non-government health organizations. Like Dr. Shiva says, the basis of fake news is fake science. So this is where we're getting all our fake science from. And they also feed to the WHO. It's a semi-important body, I would say. And then of course, big food has to comply with whatever the WHO and whatever these public health organizations say. But where do they get their recommendations from? From academia. Who gets their recommendations? From big food. So they've actually created this beautiful cycle where they can essentially do whatever the hell they want without consequence because they're controlling every step of the way. So now typically in what we would call free science, which we don't have anymore, if someone made a discovery about a drug or whatever the case may be, that would be open to the public, and then that person, whoever made the discovery, would get a patent and go through the cycle from there. That's not what happens anymore because laws have been passed through the elected officials that allow the NIH to go into business with big pharma. So big pharma, now they get the benefit of having any NIH discovered drug can go right into industry now. So it's not free to the public, it just goes directly into pharma. And then of course, the government mandated public health organizations also dictate what the doctors do. They have to comply with the regulations, right? And then big food will also influence advertising. In fact, it's been shown recently that your NBCs, your ABCs, your CNNs, all of your major media companies, about 12% of their ad revenue comes from big food alone, which is all junk food. And then all of those same large media corporations, the ones that everyone listens to blindly without thinking for themselves, where do they get their influence from? They get it from academia, they get it from the FDA, they get it from the WHO, they get it from public health organizations, and they also get it from non-government health organizations. So big pharma is also constantly influencing academia. One, because they'll pay a lot of these academics to do unbiased drug reviews, which obviously have slanted outcomes. And then they also have influence in that a lot of the big academic associations will have members of big pharma as either the dean or will be on the board. So then, of course, the WHO and these public health organizations influence what policy is being enacted by the elected officials. So a perfect example of this is COVID. So at first they were both saying, the NIH, the CDC, and the WHO, they were all saying, we need to lock down and wearing masks is not going to do anything. And now it's completely flipped. Now it's everyone needs to wear a mask, we know that they work, and we shouldn't be locking down. But no one's going to get mad at the WHO or these public health organizations. They're going to get mad at the elected officials. Okay, and then Big Pharma also has tremendous influence on the FDA. So they pay billions of dollars so that the regulations on what is considered safe and what is actually considered effective, they essentially influence that via the FDA, because now you have all these new drugs that are coming out that are not even better than the old drugs, but they're not compared to the old drugs. They're compared to placebos. So you can essentially make an isomer or a very similar drug that does essentially the same thing, has no benefit over the old drug, and the FDA totally allows that because they're getting paid by Big Pharma. Pharma also has a ton of influence on the government. Literally, there are 2 Big Pharma lobbyists for every member of Congress. That's an actual fact. You can look that up. They also will hire former elected officials for their trade group. So because of the amount of influence that Big Pharma has over the elected officials, all the legislation that they pass regarding drugs just makes it worse for us, because it will ultimately lead to us paying more for the drugs. So the elected officials allow Big Pharma to essentially outsource their R&D. So pharma companies are now spending way more money on advertising as opposed to actual R&D. And that's because the government is allowing them to essentially push that R&D burden outside of the company onto these academics. So then academia, if they're studying a drug, will report their results back to Big Pharma so that they can report the results to the public. But of course, they're not going to report exactly what academia says. They're going to take it, they're going to spin it into whatever makes their drug look better. So also, as a result of the amount of influence that pharma has over the government will they will quote unquote incentivize these pharmaceutical companies to charge as much as they see fit for any given drug. We are the only country in the entire world that does not have any sort of cap on drug pricing. Normally it's, you can charge a certain amount for a drug because it has this amount of benefit. That doesn't exist here. No, because of the lobbying that is going on, the laws have evolved so that Big Pharma can charge whatever they want. And it's a major reason why other countries, if you have a pharmaceutical company in another country, you are going to come to the United States because it's way more lucrative than it is anywhere else. So another benefit, if you're a pharmaceutical company, to doing business in the United States is that the FDA will actually allow Big Pharma to promote their products in advertising. I mean, this is crazy. Literally, the United States and New Zealand are the only 2 countries in the entire world that allow pharmaceutical ads on television to happen. And like I said, Big Food contributes 12% of ad revenue to these media companies. Pharma is next down on the list. They're at 8%. But Big Pharma, they're not done. They also lobby the non-government health organizations. Okay, so not only are doctors influenced by Big Pharma because they're being taught the Big Pharma model of medicine through medical school, through academia, which gets paid by pharma, but also if they want to continue their medical education, that goes through pharma as well. They'll pay for that. And then the doctors are also incentivized by Big Pharma because Big Pharma will give kickbacks to these doctors if they will prescribe their drug over a different one. So the FDA also passed an act that gave additional incentive to the doctors to prescribe big pharmaceutical company drugs because now that law enabled them to use these drugs for off-label use. Okay, so now I want to point out this bubble, PBMs. These are called pharmacy benefit managers. So these organizations were created in order to sort of simplify or streamline the process of getting drugs through insurance to the patients. So the way that a PBM works is that the insurance company will work with the PBM, pay them, and the PBM has their list of drugs that they support, called the formulary, and the big pharmacies get completely dictated the pricing and whatever drugs they're able to distribute because they're only going to use what the PBM offers. So now pharma comes in and they will pay rebates to the PBMs, and it's essentially pay to play at its best because whatever drug company pays the most rebates is going to be on the formulary, and the formulary is all that matters. That's all that the insurance company is going to carry. So people are essentially being forced to have these drugs because if they have their insurance, they need to go through the PBM. So I'm sort of simplifying what a PBM does here. It's kind of complicated, but essentially what you need to know for the purposes of this exercise is that they're just middlemen, and they're essentially just sinks that charge more because they need to get paid as middlemen, and they're just artificially increasing these drug prices. So the PBMs also offer mail ordering, which does not go through a pharmacy, and this is a scam for multiple reasons. They don't have to work with the pharmacy on pricing. There's no face-to-face interaction. So they essentially get all of the leverage in terms of what you can charge for a drug, and it produces a whole lot of waste because people are often getting the wrong orders. So the PBMs are going to dictate what drugs the insurance company will cover, and the insurance company is obviously going to dictate whatever the doctor prescribes. And there was actually a survey done. They found that only 19% of non-surgical physicians thought that PBMs added any sort of value. The rest of them acknowledged that it's a scam that artificially inflates drug prices. So then we also have what are called GPOs. These are group purchasing organizations. And what do? Well, they do the exact same thing that a PBM does, just for medical devices. So instead of a hospital getting gauze or surgical equipment or whatever they may need directly from a medical device company, they go through a GPO because it's supposed to streamline it. And then also, if you're in a hospital and you need a pharmaceutical, the big pharma companies are also paying GPOs to determine what the hospital gets for inpatient care. So if we take a step back and look at all of this, how does it affect you? That's what we care about, right? Well, let's talk about that. So you are going to eat the garbage that Big Food wants you to eat because the media is feeding you the wrong information from all these other bodies. And you also have these non-government health organizations that people listen to like sheep, who are obviously influenced by this whole thing. So you, as an individual, are electing these officials, right? And you're also paying taxes, which funds all this other bullshit, and that ultimately ends up back at you because they're the ones who are enacting policy. Your doctor is probably brainwashed from all of this, so he feeds you misleading information. Advertisements make it seem glamorous, so that influences you. And then you pay for these drugs either through a pharmacy or through a mail order. Either way, those drug prices are being artificially jacked up by all this crap that's going on. So you also have to pay your insurance, which is artificially jacked up by the PBM scam, and you also have to pay the hospital, right? If you're in dire straits. So, and this is getting even worse because now all of these entities are colluding. So you have big pharmacies like CVS, they will purchase PBMs like Caremark, and then those PBMs, which are already purchased by the big pharmacies, are going to purchase GPOs. So they are all colluding, controlling the entire supply chain, and essentially have a monopoly. So anywhere you are on this chart, it doesn't matter. You could be in any of these bubbles, it doesn't matter, because you could have an arrow that goes anywhere else on the chart. So then what if you have someone like us, or like Dr. Shiva Ayyadurai, or like Ken Berry, or like Ivor Cummins? We're going to call these people based because they recognize the scam and they speak out against it. What happens to them? They have some influence on you, right? But if you'll notice, this is a dotted line. Why is it dotted? Why is it not a solid line like everything else? That's because these people rarely get through to you because they get silenced. Your doctor, if they hear about these people, is going to tell them that they have no idea what they're talking about. The media is going to call them out, tell them that they don't know anything. Oh, by the way, social media is a big one for this because they have complete control. There's no freedom of speech anymore on Facebook or on YouTube or on Twitter. So if you try to call them out, they're just going to shadow ban you and silence you. Non-government health organizations like the Academy of Nutrition and Dietetics could literally have you arrested. They will call for your arrest if you decide to give anybody medical advice if you're not a registered dietitian, whatever that means. And then this base category also includes patient advocacy groups that try to, they recognize the scam. They're trying to do something about drug pricing, but they can't get anything done because they are also in the pockets of Big Pharma. So if you take a look at the big picture, it's an incredibly complex system. It's controlled by all of the people with power, all the people with money, and it screws over you. They make you sick, they make you fat, and then they make you pay more for it. So it just essentially distributes the wealth and the health upwards to the elites, and it screws over people like us. So now everyone wants to talk about, should we have free healthcare for all? Should we have Medicare for all? Well, guess what? That is impossible because everything has become so expensive. Everybody that has power and has money is not going to let that happen. And even if it were possible, all of these industries are now colluding to lobby against those laws in Congress. I mean, does this look like a free market to you? No, it's not. They're controlling everything. This is not a free market. This is an oligopoly. So what can we as actual working people do about this? We're not elites. We don't have the power to actually change anything. The only things that we can do is to not buy into this crap. Start calling people out. Start calling out the scam. Start recognizing what the real problem is. It's all the corruption. It's all of this crap. It's not anything to do with legislation. And you need to get healthy yourself so that you don't have to buy into all this. So here at Analyze and Optimize, we are dedicated to doing those two things. We want to educate people, the real science on how people can actually get healthy, and we're also committed to calling out all of the corruption. So please share this video. It's really important that people understand this because they're just trying to divide us when really we're all on the same team. We all want the same thing. We all want to be healthy and we all want to be wealthy, right? But that's not being allowed because of these assholes. So subscribe, don't let them fool you. Check out our Patreon in the description. Adios.
We want to tell you about Carnivore Aurelius's beef liver crisps. Conventional beef liver is the most nutritious food on the planet, but it tastes terrible and it takes time to prepare. Now you can get nature's original superfood ready to eat and it actually tastes good. With just 3 simple ingredients, the crisps are convenient, high in protein, and loaded with unique and bioavailable vitamins and minerals. Go check them out using the link in the description.